Hello, my name is Tom Bourhill. I'm one of the advanced practice physiotherapists working in GP practices in the west of Fife. Currently I operate in Park Road in Rosyth and Oakley in medical practices. This role involves early access to patients for complex and simple musculoskeletal problems. We assess and treat all musculoskeletal joints, but we also have the added advantage of offering corticosteroid injections, and in the near future I intend doing my non-medical prescribing, which would allow me to prescribe simple analgesia without referral back to a general practitioner. The benefit to the general practitioner team as a whole, that's both doctors, practice nurses and other health professionals, is musculoskeletal conditions account for approximately 35% of a general practitioner's caseload. By advanced practice physiotherapists being in the GP surgeries, we allow more medical time for GPs and advanced practice nurses because we are dealing with musculoskeletal problems. We are also in position as an expert advice where we inform the other health professionals in the practice in regards to musculoskeletal injury or orthopaedic conditions. The benefit to the patients is early access to physiotherapy treatment. We treat musculoskeletal conditions, orthopaedic conditions and acute musculoskeletal conditions on a select group of patients. The early intervention allows us to assess, treat and manage and diagnose these patients in a timely manner, basically looking at early access in the right place at the right time with the right clinician, instead of being referred to other clinicians and then being referred to physiotherapy. The benefits to the clinician is we've got a career progression, but we also have the benefit of seeing our patients recovering very well. The feedback from GPs and patients is good, with the significant majority of patients only requiring advice and early exercises to achieve the resolution of their symptoms. As part of our advanced practice role, we also assess and screen for red flag conditions or signs and symptoms that would warrant a referral to a medical practitioner, for example a general practitioner, or onward referral to accident emergency.
Hello, my name is Murray Maclennan. I'm an advanced orthopaedic practitioner that works in the NHS Fife in the spinal and neurosurgical clinics. My role predominantly deals with complex spinal patients that come through the system, and I work closely with two neurosurgeons from Lothian who do outreach clinics, and together we assess the patients for potential surgery or other invasive management techniques. The benefits of having the neurosurgeons in Fife that do the outreach clinic is the patient doesn't now have to travel to Lothian, where previously that was the case. So it makes it a lot easier for the patient. A lot of the investigations can be carried out within Fife as well, prior to any surgical management being undertaken. Patients have found this process to be much more beneficial, and they get seen a lot quicker than they would do necessarily in Lothian, just because we have a quicker turnaround for the spinal neurosurgical clinics. We've recently done some auditing around this, and the patient satisfaction has been really good regarding this, and we've had good clinical outcomes with how we manage these patients within Fife.